Good morning, bonjour. Thank you for being here this morning. As Acting Chief Medical Officer of Health, I'm here this morning to provide an update on COVID-19, the novel coronavirus. Today's update will touch on March break returning travelers, schools, daycares, long-term care and adult residential facilities, and preparedness measures. Le risque de propagation du virus au Canada reste faible pour le moment. Toutefois, nous devons prévoir tous les scénarios possibles et fonder notre intervention sur des éléments de preuve. Puisque des données scientifiques sur le nouveau coronavirus continuent d'être mises à jour. Le nouveau coronavirus est un problème mondial et il est possible que le virus soit présent dans des pays qui n'ont pas la capacité de détecter le virus. Although the risk of spread of this virus within Canada remains low at this time, we should plan for all possible scenarios and base our response on evidence as the science of novel coronavirus continues to emerge. The novel coronavirus is a global issue, and although many countries are reporting that the virus could be present in their countries, there may be countries where it is yet to be detected. With March break travelers returning home to New Brunswick, we are asking all travelers who return to our province from outside the country, no matter where they were in the world, to symptom watch. We want returning travelers to monitor themselves and their loved ones closely for symptoms for 14 days. Symptoms such as fever, cough, difficulty breathing may take up to 14 days to appear. Should an individual experience these symptoms and they have been traveling outside the country in the last 14 days, that individual should isolate themselves from others as quickly as possible, call 811, describe their symptoms and travel history, and follow the instructions of 811 carefully. There are special measures in place for a few locations. Individuals who have traveled to the Chinese province of Hubei in the last 14 days should limit their contact with others for those 14 days, and this means self-isolate or stay at home. This same advice now applies to people returning from Iran. I want to stress that everyone has a role to play by taking simple actions to prevent the spread of respiratory infection, including washing your hands frequently, covering your mouth when you cough and sneeze, and staying home when sick. With students returning to classrooms next week, Public Health is issuing guidance to parents, guardians, staff, and students in collaboration with Education and Early Childhood Development. There is currently no widespread transmission of COVID-19 in Canada. Therefore, we are following the lead of the Public Health Agency of Canada and recommending that schools take standard respiratory illness precautions, the same precautions that are recommended every year for cold and influenza season. At present, school closures are not recommended for the prevention of COVID-19. Key strategies to prevent and control respiratory viruses, including COVID-19 in schools, include staying home from school, both students and staff, if you're ill with fever or infectious respiratory symptoms, consistently practicing good respiratory etiquette and hand hygiene, ensuring regular and routine environmental cleaning of the facility. It continues to be important for administrators to understand the usual absenteeism patterns of their school and notify regional public health as per usual processes when absenteeism of students or staff is greater than would be expected or severe illness is observed. Pour le moment, il n'est pas recommandé de fermer des écoles pour prévenir des cas de COVID-19. Les administrateurs doivent être au fait des tendances en matière d'absentéisme dans leur école et aviser les services régionaux de santé publique au moyen de processus habituels Lorsque le taux d'absentéisme des élèves, les enfants ou les membres du personnel sont plus élevés que normal, ou lorsque des cas graves sont observés. C'est important de se laver les mains, souvent avec l'eau tiède savonneuse pendant au moins 20 secondes, ou utiliser un désinfectant pour les mains à base d'alcool, surtout après avoir toussé ou éternué. Avoir une bonne étiquette pour le toux et l'éternuement. S'assurer de tousser ou éternuer dans le pli de son coude ou dans un mouchoir. C'est important de rester à la maison en cas de maladie. C'est important de dire aux parents si les enfants ne sont pas bien et prendre avec eux des mesures pour rester à la maison. C'est aussi important de rester propre. Garder les mains loin du visage et de la bouche. Et en général, de rester en santé, de manger des aliments sains, demeurer actif et dormir suffisamment. We're asking school officials to reassure students that they are safe and there are many things they can do to stay healthy. Washing your hands often with soap and warm water for at least 20 seconds or using alcohol-based hand sanitizer, especially after coughing or sneezing. Coughing or sneezing into your arm or using a tissue, which is what we refer to as respiratory etiquette. The use of masks is not, I repeat, is not recommended in schools at this time. Students should tell their parents if they're not feeling well, and together they should make a plan to stay home from school if they are sick. Hands should be kept away from the face and mouth whenever possible. And students should continue to stay healthy by eating healthy foods, keeping physically active, and getting enough sleep. I'll now move on to long-term care. Concerning operators, staff, and residents of long-term care and adult residential facilities, Public Health issued correspondence with information on managing and protecting the facility staff and residents regarding COVID-19. This advice is very similar to the school guidance. Again, masks are not recommended for those with no symptoms in this situation. Le port d'un masque n'est pas recommandé aux personnes en bonne santé. Visitors and staff, that is, people who don't live in the long-term care or adult residential facilities, who are experiencing symptoms, should stay home from those settings. Residents, those who are living in the facility, who are ill, should stay in their rooms and minimize contact with other residents while symptomatic. As I mentioned previously, asymptomatic people returning from an identified country, such as Hubei province in China and Iran, will be asked to self-isolate at home. These individuals should start making arrangements with neighbors, friends, or relatives to get their shelves replenished and their prescriptions filled in anticipation of staying home for that period of time. Other travelers should be similarly prepared for the possibility of staying home should they fall ill. New Brunswickers are well known for being community-minded and helpful. Please continue to be kind to one another and assist your neighbors when possible. I also ask that you please be respectful of returning travelers. This is an evolving situation. It is Public Health's intention to provide regular updates and briefings on COVID-19. New Brunswickers seeking information on COVID-19 can check our webpage, or they can call Public Health Agency of Canada's toll-free number, 1-888-734-4397. I'd like to thank all of our partners, Emergency Measures Organization, regional health authorities, other government departments, and members of the media for their assistance. Thank you.
Dr. Muecke.
Bonjour, docteur. J'aimerais savoir peut-être comment le Nouveau-Brunswick est prêt à faire face à ça. On sait que les hôpitaux sont pleins et même débordent. S'il y avait une pandémie, comment on pourrait être prêt à faire face?
On a déjà, depuis plusieurs années, des plans pour les situations d'urgence et les éclosions. Et on travaille là-dessus régulièrement. On a aussi plusieurs exemples ou plusieurs situations qu'on a déjà vécues. Par exemple, l'éclosion de rougeole l'année passée, où on a pratiqué, on a utilisé ces plans-là et on continue d'évaluer et de spécifier ces plans pour les situations actuelles. Alors, il y a toujours une base d'informations, de preuves, et on travaille là-dessus et on ajoute régulièrement selon la situation.
Au Québec, ils ont libéré des lits dans des hôpitaux et même fermé des sections d'hôpital pour être isolés du reste pour ces patients-là. Est-ce qu'on a quelque chose comme ça ici? Est-ce qu'on a des lits prévus et des sections d'hôpitaux prévues?
Présentement, on a des discussions actives qui sont en train de se faire par rapport aux différentes routes pour les patients qui sont à l'hôpital, soit qui ont des mesures à prendre aux cliniques, et pour quelques-unes qui peuvent se gérer à la maison, on parle de ça aussi. Alors, il y a plusieurs routes qu'on peut utiliser selon la gravité de la situation.
Thank you. Dr. Muecke, what direction, if any, is the health office or the province itself giving to its own employees who are traveling outside of the country and may be returning on public business, on official business? Is there anything different that they're being told than what you've just described?
So we've been working closely to ensure that there's consistent messaging going out to Government of New Brunswick employees, whether they're traveling or not. And we are continuing to work with Executive Council Office on that and aligning what we are saying with Public Health Agency of Canada and with the general advice we're giving to New Brunswickers.
And what about steps New Brunswick is taking, if any, to limit large business gatherings, large government meetings? Are there steps in that direction as well?
I want to reiterate, there are no confirmed cases of COVID-19 in New Brunswick at the present time. So these are all options that are on the table that we will discuss as the situation evolves. And there's actually regular conversations at the federal, provincial, and territorial level on what that might look like as the situation evolves. There are experts getting together on a weekly, bi-weekly basis at the highest levels of public health authority across the country that are discussing these very issues.
Dr. Muecke, pourriez-vous nous dire combien de tests ont été effectués au Nouveau-Brunswick pour le COVID-19 depuis le début de la crise, et peut-être aussi combien vous en faisiez par jour en provenance du Nouveau-Brunswick?
Jusqu'à date, il y a 4 cas qui sont confirmés par le laboratoire national comme négatifs. Il y a quelques-unes qui sont en cours, mais on va les annoncer quand on a le résultat confirmé du labo national.
En anglais, s'il vous plaît.
Sorry?
Could you say that in
Oh,
English as well?
sure. So as of today, there are 4 cases that were confirmed negative by the National Microbiology Laboratory from New Brunswick. There are a few that are in progress, and we will post the status of those on our website once they're confirmed.
You had said that New Brunswickers are known for their, kindness, I guess, in their communities. Have you seen any cases of people being nervous about travelers, or I guess being a bit discriminatory towards people when it comes to COVID-19?
I don't have any specific examples, but I think it's just really important in situations like this where people are anxious and they're looking for what they can do to help. I think it's really important to remind ourselves that as a community, as a province, we have the skills, we have like the nature of being helpful and being community minded, and this is something that we're going to get through together as a community. It's not something that we need to tackle individually, and so it's really important that people continue to help each other out.
When it comes to, and in the press release it mentioned that New Brunswick has been prepared for a flu pandemic for quite some time. When it came to H1N1, are you using kind of similar preparation plans as we saw in H1N1? And on that, do you have areas other than hospitals and ERs set aside should people, a lot of people become sick?
So a couple of things. One is, as I mentioned earlier, plans for situations like this, whether it be a new virus or viruses or other types of illnesses that we already know about, are regularly reviewed, evaluated, updated. There are principles and approaches that are consistent across different types of illnesses, consistent steps that we need to take as public health authorities in order to manage those types of situations. So those continue to be used. It is important to recognize that this is not influenza, and we know that. And so we take the principles and the base of those types of preparedness documents for sure, that include things like roles and responsibilities, et cetera, and we build on that based on what we know about the particular situation that we're dealing with. So, the answer is kind of yes and no, right? We're using parts of it, but we're also recognizing that this needs to be customized, and that is being done on an ongoing basis. I think you had another part to your question. I just don't recall what it was.
If there has already been talk of preparations for actual centers, I don't know.
Oh,
if
yes,
it's a gym
okay.
Or,
Yeah, so as I mentioned as well, I know it's like French versus English, but there are active discussions going on with the regional health authorities, with clinical care settings around a variety of pathways that can be used depending on the severity of the situation and depending on how sick the individuals are. So we certainly don't want emergency rooms, for example, to be receiving people who don't need that level of care. So we're looking at a variety of pathways that can be used that would depend on the risk assessment of the individuals involved.
Kevin, you mentioned that March break travelers should symptom watch.
Yes.
But the students that are specifically returning from Italy this weekend, will they be screened in any particular way?
So as of today, all travelers, with the exception of Hubei province in Iran, are being asked to self-monitor. Those other two situations that I mentioned are very specific, and as I mentioned, they're being asked to self-isolate regardless of their symptoms. But everybody else coming from outside of the country is being asked to symptom watch for 14 days. Now, there is a list of countries on the Public Health Agency of Canada website that are higher risk, and that is absolutely taken into account when we evaluate someone who presents with symptoms in recent travel.
So, sorry, just to follow up on that question. Most recent numbers show that Italy. Sorry, the most recent numbers show that Italy and South Korea, or the Republic of Korea rather, they have more cases than Iran. So I'm just trying to understand why Iran and Hubei province specifically are the ones to be asked to self-isolate, and those other countries as well.
Yep. So first of all, just to say that these types of discussions on what to do for what particular locations are happening several times a week at the federal, provincial, territorial level. And we're keeping a very, very close eye on what's happening in all of these locations. Hubei province, I think it's relatively clear that is the epicenter of where this situation originated. They still have the lion's share of cases. In the case of Iran, certainly the numbers have a piece to play in it, but the other piece that's important for us in considering what additional measures we take is that as of today, the majority of imported cases to Canada, again, none in New Brunswick, the majority of imported cases to Canada have actually now come from Iran, not from China. As well, on an international level, there is a lower level of confidence in that jurisdiction as to whether they have the capacity to detect, institute public health measures, and control the situation. So the way the country is responding to and what capacities they have at their disposal is part of the risk assessment.
So, sorry, just to also follow back to something you mentioned about schools. So you're asking most, I guess, travelers to just self-monitor.
Yes.
For kids returning back to schools next week, you say the symptoms take up to 14 days to show.
Mm-hmm.
Should people be concerned about students coming back from travel and potentially taking 14 days to show symptoms and all that time still being in contact with other students in schools?
The evidence to date has shown that the vast majority of transmission occurs when people are symptomatic and in close contact with a case. So, we are relying on people to be effectively symptom watching and doing the right thing when they start to feel that they're symptomatic.
I wanted to ask you about rural hospitals and if you think they're going to be equipped to handle an increase in patients because of COVID-19.
So the two health authorities, Horizon Health Network and Vitalité, are both working. They both have protocols in place for their hospitals and emergency rooms across their health authorities. And so where you are in the province should not make a difference in terms of the service you receive when you arrive in an emergency room.
J'aimerais savoir, est-ce qu'on aura besoin de ressources supplémentaires pour faire face à une éventuelle pandémie?
Mais c'est sûr qu'il y a beaucoup de travail à faire avec ces situations-là et on continue à avoir des discussions, puis on continue à gérer le nombre de personnel qu'on a. C'est sûr que c'est un processus qui va continuer pendant les semaines ou soit pendant les mois. Alors, c'est important d'avoir assez de personnes, mais c'est aussi important d'avoir, de donner les personnes l'opportunité d'avoir un break, une pause.
Mais est-ce que vous avez prévu davantage de ressources pour les prochaines semaines ou les prochains mois quand éventuellement...
Oui, c'est sûr, c'est sûr. On est en train de le faire, c'est ça.
Vous aurez plus de ressources?
Oui.
Combien de plus à peu près?
Je n'ai pas les statistiques spécifiques par rapport à ça, mais on peut
est-ce que c'est plus d'infirmières, plus de médecins, plus de quoi?
Plus de personnel de santé publique, parce qu'on a vu en Chine, par exemple, que les mesures qui étaient vraiment efficaces, c'était les mesures de santé publique de base. Ça veut dire de trouver des cas, de faire de trouver tous les contacts étroits de ces cas et de les gérer effectivement.
Et dernière chose, est-ce qu'il y aura de la formation spéciale, par exemple, pour les ambulanciers qui doivent intervenir directement, les policiers, les pompiers? Est-ce qu'il y a des formations spéciales de prévues?
On a l'information et les connexions directes avec ces organismes-là, parce que c'est sûr, c'est très important que ces personnels ont l'équipement et la formation nécessaire pour gérer ces situations. You might have to remind me about what I just said.
I still have a question too.
So do you want me to repeat that in English? So the question was around what preparedness and training there is for paramedics, fire police, etc. All of our, we do have documents prepared for first responders as well as direct connections with the organizations that, that work with these individuals. So A&B, for example, Ambulance New Brunswick, just as an example. That it is incredibly important to us that our first responders and our healthcare workers have the tools, the training, and the information and equipment they need to manage this safely and effectively.
Great. So I'm curious, how many tests are currently underway? Who is performing them? Does the province have in its possession now enough test kits to face whatever challenge you will face in coming days? And what is the timeline from test to result? So four elements. Sorry about that.
So the provincial virology reference lab in New Brunswick is the Georges Dumont Hospital Laboratory. We're in very regular communication with the staff and directors of that laboratory. They have testing in place for COVID-19 at that lab, and they are able to provide us with presumptive results within 24 hours of receiving the specimen. They concurrently send part of that sample to the National Microbiology Lab in Winnipeg, which is at this stage the piece that we need to label something a confirmed case. So that capacity to, that capacity to have that initial heads up does exist in New Brunswick at the current time.
Gotcha. So is there a limit to the number? I've seen reference in the United States to test kits and the availability of enough of those kits to cover the threat. Is that an issue here?
That is something that we are in close contact with the Georges Dumont Laboratory about, and it is something that's being discussed at the federal, provincial, territorial level as well, because obviously if there's issues around kits, then that's something that needs to, that type of procurement discussion needs to occur at the national level.
Two quick ones. You hear about people stockpiling right now. You're saying self-monitor for 14 days, self-isolate if you come back from those two areas.
Yes.
Should people be prepared for 2 weeks worth of food, etc.?
So as I mentioned earlier, our focus right now is on returning travelers. And as I mentioned in my comments, we do suggest that if people are coming from those two particular locations, where we know that they're going to be asked to self-isolate for 14 days. We're asking them to, work with their friends and neighbors to replenish their own stocks so they're prepared for that 2-week period. And we're suggesting that other returning travelers should consider similar measures in the event that they may fall ill and may need to stay home for a period of time.
I have a flu question. I apologize. You put out the flu numbers this morning, but I can ask it after if you prefer.
Yeah, that would probably be better.
Savannah, last question. Speak loud, please. Sorry, but you have people watching.
What measures are currently in place, if any, at New Brunswick airports
So
for returning travelers to screen them?
So the airport, the authority around airports and international arrivals rests with the Canadian Border Services Agency. And so they are a regular member of those several time a week calls that I mentioned with the federal, provincial, and territorial authorities. And they are the ones that have in place information, screening tools, and guidance that they give out in handout format to returning travelers from international destinations.
So are they giving that information and screening returning travelers to New Brunswick currently?
They would be providing us with names and contact information for very specific situations. So as I mentioned earlier, people that are coming back from Hubei province or from Iran, if those people, when those people are identified by Canadian Border Services Agency at the border, they are screened, they're provided with information, and information from them is collected so that the provincial health authorities can connect with them when they arrive.